He pointed out healthcare coverage for Cubans begins at birth. So how does the country pay for it? And what exactly is covered? I talked about that and more with Robert Huish, assistant professor at Dalhousie University.
That includes visiting your doctor, going to a hospital, but also extra services from dentists to massage therapy to acupuncture. The ability to offer such a wide universal insurance to their population comes from the ability to keep the costs down. In real terms, Cuban health workers don't get paid a whole lot. They earn somewhere between $35 and $70 a month. So compared to what other health practitioners make in other countries, it's enormous cost savings. But beyond that, the government of Cuba subsidizes every aspect of the health system there, and as a result, the 11.5 million Cubans who currently live there have free universal access to health care.
Robert, the last time the World Health Organization ranked countries by healthcare was 15 years ago. Last year, another group, the Commonwealth Fund, put together its own ranking of 11 countries, and Cuba was not in those rankings. But generally, the study found that countries with socialized healthcare rank higher than the United States, where many people have to buy health insurance to have coverage. So how does Cuba's healthcare system compare to the rest of the world?
It's a very unique model that they have in Cuba. It's one that's been 60 years in the making, which started out as very humble settings, only a couple hospitals in the country. They focused a lot on diseases of poverty, and now it's transitioned to a very comprehensive and advanced system that handles, well, the whole gambit from still the basic diseases all the way up to advanced pediatric cardiology. The way that they do it is by ensuring that the population is in receipt of health care in a preventative manner and also in terms of creating health promotion. So that when these expensive, costly procedures that take place in hospitals that require tertiary care, that is reduced.
We've been talking about the healthcare infrastructure inside Cuba, but globally, Cuba has a big footprint. A couple of years ago, you wrote a book about Cuba's healthcare system. It's called Where No Doctor Has Gone Before, Cuba's Place in the Global Health Landscape. Cuba helped in the recent Ebola outbreak, for example, and it sent tens of thousands of healthcare workers abroad. So how is this possible for such a small country?
This is it. I mean, Cuba is only 11.5 million people, and they have 26 allopathic medical schools. By comparison, Canada, we have 38 million people, but only 18 medical schools. When Cuba began to invest in health and health services, they started very simply, very humbly, by only having 3 medical schools in the country, and then expanded state to state. Even though they've suffered very serious economic hardships, notably that in the 1990s as well as the 1970s, they never closed a single hospital, and they never closed a single space for medical education. And that's a very drastic measure that goes against the way a lot of countries suffering from economic austerity have approached their health services. So you fast forward from 1959 up to 2015, and Cuba has the capacity to graduate roughly about 3,000 to 6,000 physicians a year, both Cubans and foreigners who come in on scholarship. Simply put, the capacity to train doctors in Cuba is far beyond the domestic needs. So they're able to provide opportunities for physicians to serve abroad. So when it came to the Ebola crisis this time last year, and the World Health Organization said we need doctors, we need human resources for health, no country matched Cuba's capacity to send 465 of their own physicians right into the ground in Sierra Leone and Liberia and the other countries that were affected by that.